We and many experts in this topic think that exercise is such an important player for reducing cancer risk and helping the many people that have a cancer diagnosis. Now, the one challenge we've had is being able to gather all the scientists or many scientists across the globe in the same room to discuss the science on this topic. And that's why we organize Moving Beyond. Since last year, we've been organizing this conference, and it took an impressive amount of work to put it together. And we were able to invite 19 speakers, assess and evaluate more than 100 scientific works for poster submissions, and even organizing student activities. So I think the conference was really successful in that regard. What you'll see next will be a group of expert leaders in the field that been doing work in exercise oncology and making a lot of progress. And you'll see people talking about cancer prevention, cancer treatment, and survivorship. And I think that will be really exciting. That will kind of show to the public where we are with science on this topic, and hopefully everyone will realize how much work we've done so far. And it's really impressive. I hope you enjoy.
The exercise guidelines for cancer patients and survivors started in 2010 with the first ACSM roundtable, and then there was an updated version of those guidelines that was published in 2019. And after that, the American Cancer Society published a guideline in 2022 that agreed with the ACSM guidelines. And also in 2022, a very powerful organization called the American Society of Clinical Oncology issued a guideline repeating what the ACSM and ACS guidelines had said. There are also guidelines from Australia, from Canada, and a variety of places around the world. So there are many, many expert panels that have drawn the conclusion that exercise is ready for prime time after a diagnosis of cancer. The ACSM roundtable that occurred in 2018 reviewed 16 cancer treatment-related outcomes to see whether there was sufficient evidence to conclude that being more physically active would actually improve those outcomes. We are unable to conclude that treatment tolerance is among those outcomes yet, but there is ongoing research that will enable us to draw those conclusions. What we can say is helped by being more physically active during and after cancer treatment includes cancer-related fatigue, depression, anxiety, breast cancer-related lymphedema, sleep, bone health, physical function, and quality of life. The ACSM Moving Through Cancer initiative sits under the auspices of the Exercise is Medicine initiative at the American College of Sports Medicine, and it is the first disease-specific initiative within EIM, within Exercise is Medicine. Our bold goal is to make exercise standard of care in the setting of oncology by 2029, by which we mean that we want 40 to 50% of patients to be referred to appropriate exercise programming by that time.
In epidemiologic studies, which means you study a large group of people to understand how disease forms in a population, we've learned through these types of studies that physical inactivity is actually related to about 7 types of cancer that we know conclusively, and potentially many more. So this is a tremendous opportunity to impact population health. You take large groups of people, you study them for many years, and you understand how physical activity or the lack of physical activity is related to the development of cancer in the population. The Voices of Black Women is an epidemiologic study that the American Cancer Society has launched, and our goal is to partner with 100,000 Black women across the United States who have never been diagnosed with cancer and are between the ages of 25 and 55. And we'll learn about their lifestyle, their environment, their health history, their family history, and we'll stay in touch with them for years to come. And all of this information will allow us to understand what is influencing cancer risk in Black women across the US.
This era had a very big evolution and change in practice within the past 20 years. Patients were advised by their clinicians to rest because it was too difficult to exercise during treatment. Because of the wealth of research data and clinical programs internationally, this is changing substantially. Patients should not just be active, not inactive, but active, but really, ideally, receive a targeted, individualized exercise program that will treat the toxicities of their cancer treatment so they can do a lot better. Right after cancer diagnosis is a very interesting time because it's a difficult time for the individual, but it's potentially a time that they can change their behavior. This has been described as the teachable moment of changing behavior. So it could well be a good time for patients to introduce exercise to their treatment. Resistance training is very important for cancer patients. Often these patients, they experience the loss of muscle, loss of physical function and muscle strength with treatment. This is with chemotherapy, hormone therapy, radiation therapy, and other treatments. So resistance training helps patients restoring their muscles, their body composition, and this might lead to better outcomes for these patients, particularly even the ability of receiving treatment. So that's one example of resistance training. Even preserving muscle, it's important from a clinical perspective. It looks like that patients that preserve muscle during treatment, they have a better outcome of survival. This is data from epidemiological studies. Not just muscle mass, but also muscle strength. We've published a paper just recently, a week ago, in the British Journal of Sports Medicine, basically indicating that greater muscle strength is associated with survival. Resistance training specifically leads to an increase in maintenance of muscle strength during treatment.
We've used mouse models, so mice that have tumors, specifically pancreatic cancer in the case of my research, to identify changes in the blood vessels within the tumor that seem to be really positive for drug delivery. So the idea is that in most solid tumors, the blood vessels don't do a good job delivering blood and chemotherapy, but with exercise, now the blood vessels work better and more chemotherapy gets to the tumor. Now it works better. So that's sort of the first thing that we've learned from mouse models about the tumor response to exercise. The other thing that there's a lot of evidence for is an improved immune response. So in mice that exercise, there's a really profound shift in the immune response to the tumor that causes suppression of tumor growth in some models, not all, but in several cancer types, there seems to be evidence for that. Translating exercise research in mice into patients is a little bit complicated because it's not a one-to-one. It's not if a mouse runs for 10 minutes, a human should run for 10 minutes, right? So that would not be the right way to use the data from mice. I think the way that we should use the data from the mice is to understand some of the molecular signaling pathways and cellular changes in the tumor, and then use that to make smart choices about when to use exercise during cancer treatment. So for example, if we find in mice that protein ABC needs to change to get a positive change in drug delivery, then perhaps we can look in patients to see, is protein ABC changing? And if so, does that mean they have done enough exercise, right? And so the idea is to use the signaling pathways that we find in the tumor or in the circulating blood in mice to then really personalize what we can tell patients, right? We need you to make this protein change or this cell type change, and we learn in the mice what to measure and then measure in the patients to tell them if they are doing the right kind of exercise or the right amount of exercise.
Why it is important to study the population of metastatic breast cancer is because we have many studies in the setting of curative treatment, so breast cancer patients who are treated to get better. but there are also these patient group with metastatic disease who can live for several years but will receive treatment all the time. So we thought that it's very important to also give an exercise program to that group and study whether it helps. We know from studies in the curative setting that exercise is beneficial for quality of life, in decreasing fatigue. And now in the study we performed in patients with metastatic breast cancer, we found that also there patients benefit from exercise in terms of better quality of life, less symptoms of fatigue, less symptoms of pain, less symptoms of dyspnea, better physical fitness, and also, very important, a better social life. So that is the reason why I study it, and I think it's an important result for this population. A rather new field, and perhaps it started during the COVID-19 pandemic, is that we now provide exercise for patients training at home, but getting the supervision of a trainer via, for example, a platform like Zoom. And why are we doing that? We know from our earlier study that if you supervise a patient, he or she will get a better training and will adhere to more higher intensities. But we also know that going to a fitness center or the hospital for getting the exercise intervention is time consuming and could be a barrier for patients to go. So what we try is to combine the advantage between training at home, so there's no traveling, no costs for going to the intervention, with giving them the supervision to be able to perform a high-intensity exercise intervention. So, and that is why we now also studying the effects of live remote supervision for patients with cancer.
Digital biomarkers are measures of health that are collected from things like wearable sensors, mobile health applications, or electronic health data. They allow us to collect important health information on individuals in their real-world environment, preferably as they go about their daily life. And so if we use a wearable sensor on an individual, we can collect important physiological, behavioral, and environmental data. These data can be used in clinical trials, so they can be used in trials where we're trying to get cancer drugs approved. And when we use these in place of traditional health outcome measures, we can capture components of health that are most important to individuals, most important to cancer patients for them to get better. These types of tools can be used to measure important things related to a person's exercise performance, important to their training and their fitness, as well as important to overall health goals. In the context of cancer clinical trials, one of the most interesting things that we're most interested in measuring from digital biomarkers is an individual's real-world physical functioning. So what that means is if we put a wearable sensor on an individual as they go about their daily life, we can measure the activities and behaviors that they perform in their own environment and gain insight into how they are functioning in their real world when they're embraced with the challenges that come along with everyday life. I think that if an individual is performing exercise in conjunction with receiving cancer treatment, these tools can be used in the individual's own real world environment to help facilitate that exercise. They can use these tools to self-monitor themselves in adhering to that exercise, and they can use these tools to supply information back to researchers or clinicians about how they are physiologically doing.
So incorporating exercise program into clinical care at the beginning was quite hard because there was no really knowledge about healthcare professionals on exercise in cancer patients. But talking together with patients and with clinicians about the topic exercise helped a lot to overcome barriers and to convince healthcare professionals like nurses, physicians, to bring people into an exercise program. Like communicating about the topic and what exercise exactly is very important. So making exercise programs available to the community is really a hard question. So it depends on a lot of aspects you should consider. The first of all, you need to convince that physicians are sending patients to an exercise program so that they are talking to their patients that exercise is important in the current situation they are in. The other way is like you need to have educated physical therapists or exercise trainers who can then really help those patients. And what I've learned from my personal perspective is what cancer patients hates the most is if there is a physical exercise specialist or a therapist who is not aware of the situation where a patient is currently into, like not knowing what the chemotherapy is, not knowing what this type of treatment means for the patient. So this is very important to have informed people at all sites, and this really helps. Besides that, insurance companies needs to pay for that. Besides that, you need really a lot of people who can also serve for a lot of cancer patients in this field. But these are the main aspects.
Our Physical Activity and Quality of Life Research Lab is a new lab that exists at Champalimaud Foundation. And we have scientists, we have medical oncologists, and we have exercise physiologists. And we all dedicated really to generate science that can be actionable. So trying to answer the simple question, what dose of exercise and physical activity do patients need to improve their cancer prognosis and outcomes from their cancer treatment? The evidence we've had from the last at least 50 years or so, just points to this massive amount of evidence that we have how much exercise is a key player in oncology. So the next steps, we just inaugurated a society that's called International Society for Exercise Oncology last summer. That was driven by experts in the field that were also here at Moving Beyond. And that was really important. So we'll have that first kickoff meeting for society next year in Germany. And we're really happy about that. And then also next steps for our lab personally will be, finding the tools we need to contribute to the field as well and be there in Germany. So I'll quote someone that you saw in the video that said, exercise is ready for prime time in oncology. And I think it really is.